Okay. Hi, everyone. My name is Dave Reed. I'm the Community Engagement Manager at Mondoweiss. We hope you all are staying safe and healthy, and we appreciate you joining us today for this program. Today, we're going to get an update on the coronavirus situation in Gaza from Dr. Medhat Abbas, the Director General of Primary Healthcare for Gaza's Ministry of Health. Also joining us is Dr. Alice Rothchild, a member of the Jewish Voice for Peace Health Advisory Council and longtime activist for Palestinian rights. If you're joining us through Zoom, please post your questions in the chat window. If you're watching on Facebook or YouTube, post a question in the comments. We'll answer as many as we can later in the program. With that, we're going to turn it over to Yumna Patel, our Palestine correspondent based in Bethlehem. Yumna? I'm going to unmute you. There we go.
Oh, sorry about that. So as Dave said, I'd like to introduce Dr. Medhat Abbas, who is the Director General of Primary Healthcare for Gaza's Ministry of Health. Previously the Director of Al-Shifa Hospital, the largest public hospital in Gaza, Dr. Abbas has long been an outspoken critic of the impact of Israel's siege on Gaza and its healthcare system. Over the years, Dr. Abbas has served on the medical front lines in Gaza throughout different wars and protests, and now he's playing a vital role in fighting COVID-19 in the besieged territory. Dr. Abbas, I'd like to turn it over now to you for your report on the current health situation in Gaza regarding the coronavirus.
Thank you so much for this interview. In fact, the corona situation in Gaza has been, from the first day when we heard about it in Wuhan, China, we have never ever thought that it's gonna be changing to something pandemic and invading 212 countries all over the world. But we're just, thinking if this reached us, what would happen? And then suddenly it started rapidly, and then it was declared a pandemic and outbreak, which is involving it. So we started to, what shall we do? We have a plan in which it has like preparedness component and response component. And of course, the last one is the recovery. The preparedness part of that is just to have a quarantine, but we have not, it was not a very strict quarantine. We asked everybody who returned back from any country in the world, at the beginning from China and from some Italy and those countries. We said at the beginning, let them go and stay isolated in their homes. But that was not committed completely by the people. Some of them left home and start to move around in the streets. But thank goodness these people were not having the virus. Then things were just, too much warnings are coming from WHO. Everybody in the world is warning the people about it. So we decided that to change this home isolation to mandatory quarantine. And in fact, the resources in Gaza are very limited because of the siege and because of the economic situation, the high unemployment and the poverty which is prevailing today in Gaza. 80% of the population are relying on free food tickets and humanitarian assistance. For that reason, but thank goodness, through the cooperation with the people locally, people in Gaza and some of the ministries here, particularly Ministry of Education and some owners of the hotels in Gaza, we were able to have like 27 quarantine places for those returning back, whether through Erez or through Rafah Junction. And we have received at the beginning, the first groups, like 1,700 of them. They were in that mandatory quarantine. And among them, we have discovered 12 cases of positive with coronavirus. Of course, some of them were coming from outside positively, and some of them were infected inside within the quarantine. Of course, all of them were totally isolated in a hospital, which is called dedicated, especially in Rafah city for corona cases. We have just admitted them to that hospital, and they are operated even quarantines, which include a large number of population of returnees in particular. But then, because of this situation, of course, we have consider the training of the health professionals in Ministry of Health, doctors, nurses, and everybody, even cleaners. We have created on everybody to get protected, to protect himself and not to transmit the disease to anybody outside in the community. And successfully, we have been able to do that. But you know, the resources are very stingy in Gaza Strip. And even the so-called the protective equipment needed for professionals, there is a very shortage in those preparation. You know, we need those gowns, masks, and gloves. We have shortage in those things. And on the other hand, the material required for the PCR, the polymerase chain reaction, the test to make sure to diagnose corona, in fact, there is shortage. And today we're running out of that. So the situation is very hard and complicated. It came on top of a siege, which is prolonged for 13 years in Gaza Strip. The siege has had a very bad impact, negative impact on most of the aspects of the lives of the Gazans. And then the corona came at the end to complicate the situation on a very fragile health system, on a very fragile economic situation. So in such a time, I think the best thing to do is that to open the borders for Gaza, to let all the goods come freely to Gaza, so that we are able to ask the people to commit to what we have been always appealing for everybody: social distancing, personal hygiene, and infection control measures. All those things, they require financial support. You cannot do them free of charge. I mean, you know, imagine that we are not providing food to our patients in hospital for 2 years today. And because of the prevailing poverty in Gaza Strip, and some of those patients are very poor. Imagine today you are asking the people to wash their hands, to use alcohol gel. How could they buy it if they are very poor? If they cannot buy their bread, how could they buy alcohol gel? That would be impossible, by the way. For that reason, I think this poverty, which is prevailing today, for sure it will have a negative impact on the life of the people. But thank goodness, the Gazan community today, within the streets of Gaza, you find no corona, and that's very nice. At the beginning, when it was declared that we have positive cases registered, everybody in the community was scared, and you see the streets usually empty, no people are moving here and there. But later on, when everybody makes sure that Gaza population is clear, the people are not yet considering like before, they're not scared anymore. So now you can see them moving in the streets. But I'm still, you know, I'm still worrying about, because we have to consider the training, and we have to stay home and should not get outside unless it is very necessary to get food or to get some medical advice. And I hope deeply from my heart that this will not come, because of the health system in Gaza Strip. We have only in the governmental hospitals, we have 2,000 beds in Gaza Strip, and the occupancy rate is almost 70% most of the time. Imagine that, with a 70% full before corona. What would happen if we have hundreds or thousands of corona patients positive in Gaza? That will be a disaster. We are, of course, preparing too much schools now near the general hospitals. We are trying to equip them. We are trying to make triage for respiratory cases, not to be in contact with any other person in the general hospital. But the problem, as I was told by my son, who's a doctor also, he told me that the problem is not to communicate with a patient that you know he's a patient. You will take all the precaution. He said the problem, Dad, is that when you find somebody who looks quite normal, asymptomatic, moving in the street freely, distributing the disease without being known, and those are representing 30% of every 100 patients with coronavirus. I think the situation is very hard and complicated in Gaza. Of course, we have no cases yet. I understand this, but God forbid, if there are cases reported within the community because of the so-called endogenous transmission of the disease, that will be a very big problem for us, for a very fragile health system in Gaza Strip.
Dr. Abbas, I just want to make sure I'm unmuted. So now I'm just going to ask you a couple questions. First, sort of, what does daily life, I think this is something people are really interested in, what does daily life look like for you and other medical professionals in Gaza right now?
Well, we are just doing our best to get protected. I mean, in social distancing are being considered in all our meetings. While moving in the streets, we don't take our children outside. We try to keep washing our hands as much as we can. But research is saying that you're touching your face 23 times every hour. Well, I have reduced that, but they're still 10 times, which is, of course, it's not easy. I mean, if my hands are contaminated, there certainly will be a problem. But, now because of the health promotion programs that we are doing in Ministry of Health, the people now are not shaking hands anymore like before. Usually, it's a very common in Gaza, people are hugging each other and shaking hands. Today, that's, you don't see that anymore in the Gazan community. And the people in the street are less than before. But of course, there are still some people who are not yet worrying about Corona. They hear about it only, but they are quite sure that there is nothing and they are free and they are moving in the streets. Today, the streets in Gaza, if you go to the markets, some overcrowding are still there. Those who are financially affordable, which are very few in the community, they are buying some goods, trying to store something in their house, because we see the long lines on supermarkets outside for the countries that were invaded by this virus. For that reason, but of course, the prevailing poverty in Gaza Strip is not enabling everybody to store food in their homes. That's why it's very hard and complicated in Gaza. This is the situation, Tao.
Mm-hmm. You mentioned that there's still some, overcrowding and some people that sort of don't think that this virus is a major concern. We've definitely seen that in certain communities in the West Bank as well. So how have the people in general reacted to the situation? Has it been easy or difficult for, health officials like yourself to get people to follow social distancing orders and to really sort of understand how serious this virus is, and how do these different cultural factors play into it in Gaza?
Let me tell you, at the beginning everybody was scared, and it was very seldom to see some people in the streets. Later on, when the people felt that, oh, we are fine, then they started to move. But in fact, one of the biggest problems that we have is that, we have stopped the schools, we have stopped the universities, even prayers in mosques. Nobody's allowed now to pray in mosques. The only thing which is left to the people are the markets and malls for shopping. And so the people now are finding it the only lung through which they can breathe, I guess. And they are trying, let us go shopping. And that's why, of course, I mean only those who are financially affordable. That's why I think till this moment, the markets are full of people and there is overcrowding. But otherwise, in the streets, the people are not scared like before anymore. Sure of that, despite all the appeals of social distancing, and despite all the appeals, just stay home, don't get outside unless you have to. But I don't think that the people are obeying too much those instructions from the Ministry of Health. And that's why we are repeating those information through the radios. We're trying to make some posters and distributing them in the streets, in the public places. But we hope that they will understand, because, it's a matter of training. Even if we have no Corona today, you should be trained so that if this Corona arrives, God forbid, you are protected. But you should not just be left like that. At least the hand washing should be a very habit for every one of us today. They should be trained to do that even without Corona, so that they are ready to confront the disease if it arrives to Gaza.
Mm-hmm. And speaking of, hand washing techniques and all these, different personal hygiene recommendations, you did mention in your report, and as many people know, that access to running water and water shortages in Gaza are a huge issue. So how have, the impact of water shortages and electricity blackouts, are those still ongoing during this time? And how are those affecting, the people's ability to sort of fight this virus?
Well, usually we find water in our homes, but not potable water. It's not the drinking water is the problem, because the underground water that we have is having high salts and nitrates, and they are very harm to the health. They are not, they cannot be used by humans anymore. It's very hard. You cannot. But potable water is the biggest problem today that we have. For that reason, water issue. The electricity issue is a disaster. This is a very big problem, a very chronic problem, which is, of course, one of the impacts of the Israeli siege imposed in Gaza Strip, because the people are not free, to import what they want, to export what they want, For that reason, I think that we are still suffering. Today, there are some people selling electricity for high price in the private sector. So those who can buy this electricity, they pay for those generators and have a line, and those who are poor will remain using candles till this moment and the LED light.
Mm-hmm. You did mention in your report that the Ministry of Health in Gaza reported today that you've run out of coronavirus testing kits. Do you know when you can expect to receive more, and how the absence of these testing kits right now is going to affect immediate containment efforts?
Well, let me admit that Gaza is the largest open prison in the world, as it's always mentioned by everybody. And let me tell you that when we want something, we're not paying for that. We spend money from the pockets of the other. Unfortunately, this is the situation. Whenever we want something, we have to appeal and appeal and appeal, even if it will claim lives of people, because of the poverty that we have today in Gaza Strip. You know, previously when the borders were sealed, we lost the lives of many of our patients. Cardiac patients have died while waiting the borders to be opened or a permission to get outside the borders. Children have died. Cancer patients have died. The situation was very hard before coronavirus. Today, it's getting more and more complicated, and it's adding too much pressure on a very fragile economic situation and health facility system. For that reason, I mean, you never expect improvement. We have appealed for those reagents to diagnose corona. We are appealing and appealing, but the response, I cannot say yes unless I receive something in my hands, a bird in the hand, but we have no bird in the hand yet.
Mm-hmm. And one of my last questions before we move on to Dr. Rothschild is, you mentioned that Gaza hospitals are at 70% capacity right now. So what is the sort of maximum number, of cases that Gaza could reach before the health system would not be able to sustain anymore? Do you have an idea of what that number looks
Well,
like?
we have the maximal tolerance of MOH, according to the plans that I used to hear here and there in MOH, is 2,000 cases of corona. After that would be very hard and complicated for us. At that time, all our hospitals will be full. At that time, all the schools will be full, and all the health professionals, even medical students, will be involved in the emergency plan during that time, and even volunteers. But after that, that will be very hard and complicated. It's a very hard, it's a prison. Gaza is not free like any other country in the world. I mean, we cannot appeal to some other country to bring us health professionals. They need permissions, which are not issued by Palestinians in the prison of Gaza. No.
Thank you. I want to, hand it over now to Dr. Alice Rothchild, who's joining us from the US, for any questions that she may have, questions or comments for Dr. Abbas.
Well, thank you so much for sharing all of this knowledge with us. One question I had, could you focus on what are the realities in the refugee camps? About 70% of people are refugees. They're living in very crowded situations, large families. How are they accomplishing social distancing, personal hygiene, hand washing in the setting of the refugee camps?
In fact, they can never, ever do social distancing when you have 10 persons trapped inside 2 rooms. That will never be a possibility. And that's why we have increased the number of the quarantine. In case something wrong happen in the community, we will try to take all the patients outside. We cannot let them stay within the home, because they will certainly infect everybody in their homes. We understand this from the beginning, because those camps are highly dense areas in Gaza Strip. Shati camp, Brage camp, Khan Yunis camp, all those camps, they are full of people. Too much overcrowding in every room, not even in every house. For that reason, it's impossible to have social distancing and personal hygiene regulation. There is no way, unfortunately, but we will do our best to take them outside those places. And this is, by the way, one of the impact of the Israeli siege, which is imposed on the people here in Gaza. It's the prevailing poverty. The people has to live they have to live on this very hard economic situation, and they have no solution, unfortunately.
And the conflict between Hamas and Palestinian Authority, what is the impact of that on the Ministry of Health and the ability to get funding to do what you need to do?
This is what we call the Palestinian split. And everybody hates that in Gaza. Everybody, from all the Palestinian factions. We are one people. We are one nation. But I hope these are the dreams of every Palestinian, to have this political split finished. But yet it's not. We hope that soon it will be solved. But yet it is not on the ground. Is not seen yet, unfortunately. But of course, as people here in Gaza, we are one unity. We are doing our best. Differences between the people here are not affecting too more cooperation to confront Corona or to confront the hardship in the life aspects of Gaza Strip.
Okay, and has there been any change in the policies regarding permitting for people to leave the Strip for medical care from either Israel or Egypt?
No, we in fact, we're asking people not to get outside. We're asking the people not to get outside because we don't want them to return back with any disease. So we advised everybody, it was declared by MOH, please, if you have no necessity to travel outside. But and now, so the borders are almost sealed, except for those who are returning to Gaza. And of course, immediately they return back to the quarantine. By the way, everybody was resisting this quarantine at the beginning. We want to go back home, but of course, now they understood that when Gaza population are protected, now they understand that that it was right from the beginning. It was the best thing that we have done because we have had nothing to do except protection and prevention. Otherwise, it will be a disaster.
But if you're very ill in Gaza, either with a coronavirus-related problem or with cardiac or cancer or all the other issues that people have to leave for higher level medical care, are people able to get out, or is it still incredibly restrictive, or is there any change?
Yes, they can still make it if there are some special cases. But in Beit Hanun Junction or the Erez Junction, but usually it's very complicated. The Israelis will not allow anybody easily to travel outside. The people are interrogated. Some of them are arrested. It's a prison. It's a prison. And on the other side of the border, which is Egypt, people may travel, may do it. But, the people are poor. How could they cover the expenses of traveling outside? That's not easy. Not everybody. You may have a referral abroad which will cover your treatment, but how could you pay for transportation and accommodation? It's very lives in Gaza. Too much people died because of their prevailing poverty.
And the Palestinian laborers who were working in Israel and who came back to Gaza, what is the status of those people? And
they're not going anymore. There had been, as I heard, 4,000 of them from Gaza Strip, but now nobody is getting outside. Because if they return back to quarantine and nobody is willing to stay in the quarantine for 25 days, just for working for 1 day, then you're trapped in a quarantine for 1 month. That's not practical. That's why they do not go anymore.
And so this must have a huge economic impact on the families that these laborers were supporting.
Economic impact, which is already destroyed. No economy. Really, believe me, we work for 40% of our salaries for more than 5 years today. 40% of every month. Usually, an employee in Gaza Strip, when he takes his full salary, usually this will not be enough to meet his financial needs and his children. Imagine that this level of financial drop from 100% of poor salary to 40% of that. And the 40% were not even regular, were not every month. Sometimes the 40% were paid only 8 months per year. So it's like an average of 30% of the salary every month. That was a disaster. So too much educated people have changed it to social hardship cases because of the poverty. So what about those who are unemployed? What about those who are patients and they need special treatment? And MOH cannot provide most of the treatment because, again, of the prevailing poverty and the shortage of budgets. We have 60% shortage of medications in MOH. And more than 50% of the medical supplies. That's not available in our stores. So how could a poor patient get managed to be treated? This is very hard. And and as I told you, many people have already died because of that. Yeah.
And we understand that there are 12 people that have been identified as having COVID-19 in Gaza. How are they doing? Are they recovering? Are they critically ill? What is their status?
Well, fortunately, thank goodness that all of them were discovered by our colleagues in the quarantine just by taking history, because no one of them was complaining. And, all of them were asymptomatic. And fortunately, they were discovered by our colleagues. And we were very lucky, by the way, for that, because, if those people were left to go to the community, we would have reached a disaster by this moment, by the way. thank goodness that they were discovered and the PCR were positive, and immediately they were taken away, isolated in that corona hospital, and they were not even allowed to stay within the quarantines. And yes, they are now 13, they're not 12, by the way.
13, okay. And how many other people are quarantined? What's the level
Well,
in the special
there had
quarantine?
been 1,700. Today, there are only 1,000. And some people are expected to come from Egypt. I hear there are 2,000, but I'm not sure of the number. But too much people told me that they are in Egypt. They're waiting now for coordination to pass the borders. And I hear there are 2,000. But I think till now, we can still control having room for every one of them. They are still manageable. This number can still be manageable. And there are no cases in the ICU, by the way. All the cases that were diagnosed were asymptomatic, and they are doing well. Those who recover and those who are still under treatment, I mean, everybody is stable and we have no problem in them. They will recover, hopefully, but we hope in the future that things will remain like that.
And I understand that Gaza has a very young population. So if you close the schools, you have hundreds of thousands of children that are not getting educated, and also the mental health stresses of not going to school and being at home. Is there any, can you comment on that situation and any supports to the educational system or supports for the children's mental health?
Oh, that would be on the long run. It will not appear when, few weeks of closing the schools, but on the long run, of course, it will be a disaster. And believe me, nobody knows all over the international community at what time this corona issue will be finished. Nobody knows. And nobody knows what are the consequences in the long run. Everybody is expecting, but nobody knows the reality. As far as there are no vaccines, there is no effective treatment for this disease, nobody knows whether there will be back some universities or schools or not. And this is not applied only in Gaza, it's everywhere in the world. But because of the poverty and lack of computers, lack of internet, lack of electricity, even online education will be a very big problem for our people here, as you know. And the other component of this issue is that the children who are trapped inside their houses, asked not to get outside to the street, take care of social distancing, sometimes they do not understand that. It's very difficult to explain this to a child. And for that reason, today we are doing health promotion programs to explain to the parents how to manage their children inside their very tiny homes, and how to spend time with them, how to be positive with them. But of course, may God help us to do this mission. It's a very hard and complicated mission. It's not easy.
And in the US, we're seeing a major increase in domestic violence and partner-to-partner violence because of all of the people staying home. Is that peaking in Gaza as well?
Well, that should be, but that should be the situation, of course. I mean, we haven't yet heard about it because there will be, of course, gender violence, GBV, gender-based violence, and there should be some violence against children. This is, very natural because of the stress. And that's why we're doing our best to help the people, to let them be aware how to manage those cases. But yet we have no registered cases because the people are not committed 100% of staying home policy. This is what I mentioned from the beginning. At the beginning, they were scared. Today, I think they are not.
And in terms of people who are working with the coronavirus patients, do the professionals have enough personal protection? What is the status of masks and gowns and the emergency
Do you hear me?
who run the ambulances? Do they have masks and gowns? What is the status of personal protection?
We have some, but not enough. Not enough at all. Today we are still considering ourselves in the preparedness state. Because those 12 cases are already isolated and we have the quarantine. Okay, now things are fine and stable. But if we start to have endogenous infection between people within the community, God forbidden, that will be a disaster because all the reserve that we have will never ever be enough. These are disposable and you have to burn them. They are not reusable. You cannot, sterile them and use them again. You can never do that. For that reason, and they are very expensive. Imagine that big economies like United States, like Italy, like those, they are suffering today and appealing for help from the international community. What about Gaza, in the prison of Gaza? That would be very hard.
And there has been talk of cooperation between Israel and Gaza around these issues. Do you see that at all, or is that just talk, or what is
I heard about a lecture the Israelis have done at the border, and some Palestinians from Gaza attended that lecture to discuss corona issues. But apart from that, I haven't heard anything.
So the status is pretty much the same.
No, nothing on the ground. I mean, yet
Mm.
when we have PCR reagents, when we have personal protective equipment, sure, I'll let you know, but we haven't.
Okay, and my last question has to do with the whole issue of the brain drain that Gaza has suffered. Many physicians have left. What is the impact of that when you see the coronavirus? Are doctors coming back? What is the status of that?
Well, everybody who will come back is welcome in the quarantine, but not to the hospitals. You know, some of the Palestinian prisoners in the Israeli jails, when they were released, they were received in the quarantines. I mean, they were not, nobody. That's why, I mean, nobody. Believe me, it's not a time to travel today. It's not a time to travel. Nobody's moving now. Everybody is trapped within his country and trying to do his best to save himself, his country, and his children. I mean, we haven't heard about that. No, as far as I know.
Thank you very much.
You must welcome. Thank you so much.
That's super. Thank you, Alice, and thank you, Dr. Abbas. We've got a few questions that I wanted to bring in from online, the folks who are watching. Dr. Abbas, could you briefly outline the impacts on the different hospitals in Gaza? I know that there aren't that many. And how is this impacting each individual hospital? We have a few questions from folks who have either visited Gaza in the past and been to some of these different hospitals, and they're curious about what's happening there.
Well, we have stopped elective surgeries in all the hospitals, and we are only doing the emergency surgeries. And we have stopped the outpatient clinics in the hospitals because of the overcrowding. So just as a part of social distancing, and we said that those who are only in need, they should come to the emergency room, but they cannot come as elective cases. And of course, we have started a very long training process of the staff to manage the outbreak. And one of the problems, it's not only in Gaza. We usually, when you ask any doctor or decision maker in Gaza, what are the specialties needed in Gaza, he will say neurosurgery, neonatology, pediatrics, like that. But nobody will say, oh, preventive medicine. That was not said. It was not, nobody has ever thought of an outbreak like that will invade all the countries all over the world. Nobody was imagining that. For that reason, I think today, even the view of the health system, not even in Gaza, all over the world, they will start to consider reforming the health systems, which proved to be fragile in most of the advanced countries. What about Gaza? So the hospitals today, they are operating with the emergency states of capacity because of stopping surgeries, stopping outpatient clinics, and they are preparing for the worst. But of course, thank goodness, no corona cases in our hospitals till this moment, except for the one designated for corona in Rafah, which is having the 12 cases till now.
Thanks. Yeah, there was another question. We know that more than 1 million Gazans depend on UNRWA for food assistance. How has food distribution in Gaza been affected by this crisis?
Well, I personally, I don't know. I haven't received that food before. Sorry, I don't know.
Okay, fair enough. Are you getting support from any other nations?
Well, as I said at the beginning of this interview, that in Gaza here, we are appealing and we are spending money from the pockets of the others. We are appealing and appealing and appealing for everything that we want because we have no financial resources in Gaza. But for that reason, I mean, we appeal and we wait somebody to reply. The problem is that the size of the response and the number of those who are responding are not like before anymore. It's not, they are never like before anymore. Some of the organizations are still extending a helping hand, but the amount of funds are very minimal, not enough to meet any real need in Gaza Strip, which is explaining why today we are having shortage of the personal protective equipment and the reagents required for diagnosing corona.
Yeah, and along with that, several people have asked how they can help. Are there any specific organizations that the Ministry of Health in Gaza works with that that are able to get supplies into Gaza for your hospitals that people should know about and contact if they're interested in?
Well, the Norwegian government is helping us, and I think there is an organization called MAP UK. Also, they are doing very well, and some, of course, Japan. They are also extending helping. I can't recall all of them now, but some of those organizations are helping us. But I think MAP UK is one of the best organizations helping us. The Qatar is the Red Crescent of Qatar. Also, they are helping us in Gaza. As I mentioned, the situation is very hard, and a lot of funds are required to enable us to confront this virus.
That's great, and thank you to all the attendees for the great questions. Yumna?
Yeah, I actually had one more question before we go. Just a final question for Dr. Abbas is just looking forward, looking into the future, how do you feel right now as a Palestinian living in Gaza and also as a health official? You know, what are your major fears and concerns looking into the future now, as it seems that this pandemic is not going to end anytime soon?
Future in Gaza, if Gaza is left like that, there will be no future. Gaza is facing a very long siege. Gaza is very fragile because of the poor economy and the siege which is imposed for more than 13 years today. What sort of future is that with this outbreak coming on top of the victim of the Great March of Return and coming on top of the disabilities all over because of the aggressions, these aggressions before? I mean, it's a very hard situation. Even the infrastructure, the students who are not affordable to pay for the universities, the economic collapse of the universities, and the hardship. I mean, the future, I hope it will be good. I don't know how, but if the siege is left, if the Palestinian reconciliation occur, if the borders are open, I think the situation will be better. Otherwise, we will remain in a very hard situation.
Thank you so much. Is there anything else that you'd like to add that you feel that maybe we didn't touch on before we move on?
Well, just we love peace, and we want to live free like any other nation in the world. So I think it's immoral to let the people live under siege and under corona at the same time. This is very hard. I hope as a human being, we should feel with 2 million people trapped inside 360 kilometers square and suffering from poverty with sealed borders. That's a humanitarian crime. It should stop at once. This is my appeal to everybody who can hear me today.
Thank you so much. And Dr. Alice Rothschild, I also wanted to ask you just quickly before we wrapped up about what JVP is doing in the US right now in terms of Palestine activism, specifically when it comes to battling COVID-19.
Yes, thank you so much. So JVP, the Health Advisory Council of JVP is doing a weekly timeline of what's happening with the COVID virus. It's on the JVP Health website if people want to know all the sort of health, political, analytic stories that are coming out. We've also just launched a letter writing campaign to the Secretary of State and members of Congress, and I put this in the chat box. There's a link to the action, and we're urging people to go to the website and take the letters that we've written as their and send them to their own members of Congress. All the instructions are on that, but it's at jvphealth.com. And as I said, the actual URL is in the chat box. I also have a list in the chat box of organizations in the US who are doing specific emergency relief for Gaza in relation to the COVID virus. And they include Grassroots International and UNRWA and the Gaza Mental Health Foundation, the Rebuilding Alliance, Middle East Children's Alliance, and Palestinian Children's Relief Fund. So I have all of their URLs in the chat box if you want to be donating to these organizations.
Thank you so much. Were there any final thoughts that you had or that you'd like to add before we move on to Dave's final comments?
Well, I think that we need to remember the context in which this pandemic is happening in Gaza, and to understand that Gaza is as Dr. Medhat had said, in a state of virtual poverty and disadvantage, and to add a pandemic on top of that would be completely devastating. And it is a real tribute to the Gazan people that they've been able to limit this to 12 cases. But if this explodes into the Strip, it will be a catastrophe on top of a catastrophe. And it's very important for us to keep that in the forefront of our minds and to urge our own government to lift the siege of Gaza and to urge the Israeli government to lift the siege, because that is ultimately the only thing that's going to truly protect the people of Gaza.
Thank you so much, Dr. Rothschild and Dr. Abbas. I'm going to hand it over now to Dave for his final comments.
Super. Thank you all so much. This has been a great program. We're going to go ahead and wrap up. Again, we want to thank everybody, all the attendees for joining us. For those of you new to us, Mondoweiss is an independent nonprofit news and analysis publication from a left progressive perspective on the Israeli occupation and its impact on US politics. Our content is completely free. We don't have a paywall on our site. We're funded by readers. And if you found this program useful to understanding what Palestinians are facing right now in this crisis, please make a donation. It'll help us offer more programming like this in the upcoming weeks as we continue to cover the coronavirus outbreak in Palestine. You can donate securely online by visiting our site at mondoweiss.net/donate. I want to thank again Dr. Medhat Abbas for taking time out of his very busy day to join us. Thanks also to Dr. Alice Rothchild and the JVP Health Advisory Council for co-sponsoring today's program. You can learn more about their work, like Dr. Rothchild said, at jvp.org. Everyone, please stay safe, wash your hands, follow the World Health Organization guidelines to help prevent the transmission of this virus. We'll be following up with everyone with the information that Dr. Rothchild shared and the recording of this webinar afterwards. You can watch it again if you want. Again, thanks everybody. Have a good day.
Thank you.